This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for extract 1.
You hear a doctor talking to a new patient called Mrs. Black. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mrs. Black, isn't it?
Yes.
I believe it's your first time to this clinic?
Yes, we've just moved to the area, so we're looking for a new GP.
Right. Well, how can I help you today?
Oh, well, I'm actually a bit worried about our daughter Mia. She's 15 now and she's always been very healthy, but recently she's gotten very thin and I'm worried that it might be anorexia.
Okay, I see. Can you tell me a little bit more about Mia?
Well, she always used to eat with the family, but lately she says she hasn't got time to eat with us because she's too busy. So she takes a plate into her room and eats in there. She skips breakfast a lot as well, or just has a glass of juice, a couple of bites of toast before she goes out the door and off to school.
Mm-hmm.
It all started late last year, but I'm really not sure what triggered change.
And what about school? How's she going?
Oh, she's a good student. She gets high marks in most exams. Her teachers have always said she's a quiet girl, but she works really hard. Now that I think of it, her maths teacher told us at a recent parent-teacher interview that lately she seems to be having trouble concentrating in class. He said that she was never like that before, and he wondered if we could think of any reason why it might be happening now.
I see.
She doesn't have many friends, just 1 or 2 girls she's close with. She's always been a bit shy and reserved. She doesn't have a boyfriend, and we wouldn't allow it at her age anyway. After school she does ballet, which she loves, but apart from that she tends to spend a lot of time lying around the house, usually in her room.
And what about her weight? You said she'd become quite thin?
Yeah, she really has. I've tried talking to her about it, but of course she won't tell me how much. Her clothes don't seem to fit her properly anymore, though. They just hang off her like sacks. She seems obsessed about her appearance lately, too. I always catch her standing in front of the mirror. I don't think she's sleeping very well either. She stays up very late at night, reading or playing around on her phone. And then, of course, she'll be tired and moody in the morning.
Anything else you can tell me about Mia?
Oh, yeah, she seems to have been getting a lot of headaches lately. I can't remember her really having them before, and I found a box of laxatives in her room. I even think she's been throwing up, but she denies it, of course, so that's a big concern for her father and me too. So what do you think, Doctor? From what I've told you, do you think Mia has anorexia?
Well, without meeting Mia and assessing her, which I think I'll need to do, it's hard to make that judgment. However, I can give you some information about anorexia, and then I think we need to arrange for me to see your daughter sooner rather than later.
Okay, I understand. Anything you can tell me, any advice you might have would be very helpful. We've tried talking to her to see if she's all right, but she's very sensitive about it all. The moment we mention anything, she gets very upset.
I do understand it's difficult, but the good news is there are options available. If we think it's necessary, we may even have to consider referral to a psychiatrist.
Extract 2 questions 13 to 24.
In this task, you'll hear a physiotherapist talking to a patient called Ryan Henderson. Answer the questions below by completing the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Ryan Henderson? Please come in and take a seat. My name's Kathy. I understand from your GP that you've got a problem with your knee.
Oh, hi there. Yeah, that's right. It's just the left knee, just below the kneecap. It started about 4 weeks ago. I first noticed it when I'd go for a run. I'd get this sort of niggling pain, which would get increasingly worse. It's gotten to the point where sometimes I even have to cut my run short.
Does anything else seem to aggravate it?
Yeah, actually, going from when I'm sitting and then standing, or when I'm sitting at a desk with my knee bent, I really feel the pain then. It's not very sore at the moment, but it seems to be getting worse as the day goes on. It doesn't wake me up when I'm sleeping or anything like that, but it seems to go away during the night, and I suppose that's why it feels better in the mornings.
Okay. Do you have any other symptoms like pins and needles or numbness in your knee?
No, nothing like that.
Do you have any history of injuries or accidents that might account for the pain?
Well, I cut my left knee pretty badly climbing over a concrete wall when I was younger, but that was about 15 years ago or more, so I don't think that would have anything to do with this. It gave me a pretty crazy scar though.
Ah, I see.
Other than that, I've just had your typical sorts of injuries. I broke the little toe in my left foot playing football when I was about 10. Ever since then, I've had to wear shoes a size larger. Then, when I was about 25, I twisted my right ankle playing squash and ended up breaking a small bone just here, what's it called? Is it the fibula?
Ah, yes, that's right.
Okay, but it's been fine. Haven't had any problems with it since. Then just last year, I broke the little finger on my right hand playing rugby. Totally unexpected that was. And I almost forgot I've had this bursitis in my left hip.
And when was that?
Last year, I saw one of your colleagues actually for some physio treatment, and they said to take a break from running for 6 months, which I did. I did a lot of stretching and I started doing yoga twice a week. It seemed to help, so I was able to start running again after Christmas.
And is the bursitis better now?
Yep, there's no pain in the hip. Now it's the darn knee that's giving me grief.
Yeah, well, can I just get you to stand for me and put your full weight on your left leg?
Yeah, sure.
Tell me, how does that feel? Any pain or discomfort?
Yeah, I can feel it is a bit niggly just at the front of the kneecap, and I do feel a bit of pain.
And if you do like a little half squat, bend your knees and come back up. What's that like?
Oh, ow. I can feel a bit of pain in both knees actually. More in my left knee, like a sharp pain, but there's definitely a little ache in that right knee now as well. I'll just try standing on my left leg again and see what that's like. Oh, that really hurts.
A lot worse?
Definitely.
Okay. Can you sit on the side of the bed and I'm just going to test the muscle strength. I want you to push your right leg out against me as hard as you can go. Is that okay?
Yeah, okay. It's harder to do with my left leg though. Like it's weaker or something. Like I can't get enough power through it. That's really strange. I hadn't realised it was that weak before.
Well, Ryan, I think I know what's going on with your knee. It appears that your kneecap is a little bit out of alignment.
Oh, wow, okay. And how does that happen?
It can occur because the ligament, which we call the iliotibial band, it's gotten a bit too tight on the outside of your thigh. And in your case, I can see that there is some minor swelling on the outside of your left knee, which means there's some underlying inflammation there.
I guess that explains the pain then. Seems like my days of pounding the pavement might be over. I might have to find some other way of getting my exercise. That's really disappointing. I've been into running since I was in secondary school. Used to be on the cross-country team and everything. But now it seems like every time I lace up, I get problems.
You will hear part of a consultation between a GP and a patient called Mrs. Brownstone. For questions 1 to 12, complete the notes with a word or short phrase. Hi, Mrs. Brownstone. How can I help you today?
Hi there, Dr. Rivers. I'd just like you to do a test on my waters. I've had a few problems recently. I have to go quite a lot more, and it's started to burn a little and just been a little bit uncomfortable.
I see. How long have you had these symptoms for?
Well, it's been sort of goes on and off for about 3 weeks, closer to a month, really. Some days it's better than others. I don't take too much notice. I put a lot of it down to age, but I don't think there's anything really serious, but just wondered. It seems a bit strong at the moment.
And have you had this sort of problem before a lot or not?
Oh, yes, it's happened quite often over the time. Normally just antibiotics clear it up. I'd say I've been treated for this, at least 5 times in the last 10 years.
And you've left it for a few weeks before coming in to see me. Do you sometimes get symptoms that come and go like this?
Yes, they do. And I just try to drink more, which I'm very bad at, drinking water and such like, but I try. And it usually goes. Well, it usually just goes off by itself, really.
Okay, and what about nighttime? How are you at night?
Oh, I'm up and down a lot. 3 times out in the night at least, every night. And it's more painful at nighttime, funnily enough. And it's much more urgent. At night there seems to be a lot of pressure. I think it's been going on for such a long time it's becoming normal.
Right, okay, well, that's not something we want you to be getting used to. Let's see what we can do. When you've had these symptoms in the past, you've had the antibiotics, did it calm it down?
Yes, antibiotics seem to do the trick.
And what about accidents? Any accidents with the waterworks?
No, I just have to make sure I get there quickly. I do find when I've been sitting for a while, once I get up, I've got to go immediately. So I always want to know where the loo is wherever I am.
But if you cough, sneeze, or laugh?
No, nothing like that.
Yeah. So what I'm keen to do actually is just to give you a short course of antibiotics and see how you get on. If you've had this similar things in the past and antibiotics have helped, I think that the first step is to see what happens if we do the same thing.
Right. I'm not sure if this is important or not, but I had a series of water problems way back, 25 years ago or so. I had a colposuspension in 1980-something. I was 50. And that worked. It worked well, I think.
Good. Okay, let's keep that in mind, but we will start with some treatment. But if it's not improving, we'll need to reassess the bladder function a bit more closely.
Right, okay.
Are you allergic to any medications as far as you know?
Yes, there's a few. Septrin, amoxil, and... Oh, what's the other one? If you can just hold 2 seconds, I'll tell you. Keep it written down so that I can... So, Septrin, amoxil, and trimethoprim.
Trimethoprim. Glad I knew that, because that would have been my first choice. You've had something called nitrofurantoin?
Yes, I've been okay with that one. The nitrofurantoin, I've had it before for 5 days.
Right, thank you. So, as you asked for, I will get you to provide us with a sample we can send to the lab. I think that what I want you to do is drop back in and see us in 5 days, and we can review the results and discuss how the medicine is working, okay? You will hear part of a consultation between a doctor and a patient called Mrs. Chambers. For questions 1 to 12, complete the notes with a word or short phrase.
Hello, Mrs. Chambers. I'm Dr. Bakari, one of the obstetricians working here at the hospital. I've just come to ask you a few questions. What is the reason you came into hospital today?
Oh, well, I started bleeding.
Oh, I see. When did you start bleeding?
I had a bleed on last Sunday.
Okay, and how many weeks pregnant are you at the moment?
I'm 36 today, and I started bleeding about a week ago.
And did you have any bleeding before that?
Actually, yeah, I did, in February.
Okay, in February. How much bleeding did you have? Was it quite a bit or just spotting?
About half a cup full, and I was 28 weeks then. But the bleeding only lasted for not long, a couple of hours, then it stopped.
Okay, and when it started last Sunday, how long did it last then?
It lasted for about 3 hours, but then I'm spotting and having some old blood coming out now. Yeah, and it was quite a bit of blood. I would say about a cup full.
A cup, okay. And with this episode, did you have any pain anywhere at all?
I just get a tightness in my tummy and I get cramps. And a quite severe pain in the lower abdomen here for a bit, but it comes and goes. It started when the bleeding, at the same time as I was bleeding.
Okay, and did you have pain at 28 weeks when you had the bleeding then as well?
Yeah, it's just like period pains, cramping.
Okay, all right. Any other symptoms at all?
No, not really.
Okay, and with this pregnancy, other than the bleeding, have you had any other problems?
No.
Okay, and have you had a scan since this bleeding started?
Yes, I had one when I was 34 weeks, and they found the placenta was low, but I haven't had another one since.
Okay, and when is your next scan due?
I haven't got another one now.
Okay, all right. And when you had your booking scan at 12 weeks, everything was normal then?
Well, in my first scan, they struggled at 12 weeks to find it, so that was sort of like an internal scan, but they just said it was because it was a small baby or something. But other than that, everything was normal, I think. My visit at the antenatal clinic, everything was normal. I remember my Downs risk was low.
Okay, so everything was fine. That's good to hear. All right. Have you had any previous pregnancies?
Yeah, I've got 2 little boys. They're 2 now. Both very healthy, just a bit naughty.
All right. They twins?
Oh, yes, sorry, they're twins.
And was it a normal delivery or was it by cesarean section?
No, normal.
Normal delivery, no instruments used, nothing like that? And you didn't have to go into the intensive care unit or neonatal unit, nothing like that?
No.
Okay, all right. I think I'm starting to get a good picture. Tell me, have you ever had any uterine surgery or procedures?
Oh, yes, about 4 years ago, I had to have an abdominal myomectomy.
Oh, I see. That's good to know. What symptoms did you have with that?
It was almost exactly 2 years before my boys were born. I was really suffering, migraines, body aches, and even a fever with my period. One time the pain got so bad I had to go in for an MRI, and they found some pretty big fibroids, and at the time we were struggling to get pregnant, so the doctor suggested I have the fibroids removed. I was really nervous and considered not getting it done, but